Martha, you're muted.
Good morning. My name is Martha Carr, and I'm the managing editor of the Times-Picayune, the New Orleans Advocate. Thank you so much for joining us today for a panel on the impact of Mardi Gras on our COVID cases and a look ahead at what might happen in the coming months. Our panel of expert sources will discuss the current COVID numbers, the next surge, and how efforts like wastewater surveillance will help us understand a future rise in cases. We'd like to thank our sponsor, AARP. Here is a short video message.
Good afternoon. I'm Denise Botcher, AARP Louisiana's State Director, and I want to welcome you to the Advocates Town Hall. AARP is a nonprofit, nonpartisan member organization and has been working to promote the health and well-being of older Americans for more than 60 years. We're proud to sponsor today's roundtable to help you get the information you need on the pandemic, whether it's facts about the vaccine or how you can safely get back to the life you want to live. We're feeling safer in public and looking forward to a great spring and an even better summer. Being fully vaccinated has proven to be the best line of defense against serious COVID illness. It may be time for you to get your booster. Don't wait. Let's keep our progress going. Sleeves up, Louisiana.
Now I'd like to introduce our health reporter, Emily Woodruff, who will lead the discussion.
Thanks, Martha. So we have emerged from Carnival season and we've gotten really into the thick of what I think of as the greatest time to be in New Orleans. The weather is amazing. We have Jazz Fest and French Quarter Fest to look forward to. And our COVID numbers look good right now as we come off the Omicron wave. But even though we're in a lull right now, we know that we'll see cases rise again. And in fact, we are starting to see that in other parts of the country. We've been in this position before, and we have to remember that the pandemic is not over, and we want to understand how our risks are changing as this continues. So to help us understand that, we've assembled a panel of 3 experts, and I'm really happy to have them all here with me today. First, we have Dr. Susan Hassig. She is an epidemiologist at Tulane University. Thanks so much, Susan, for joining us. We have Dr. Catherine Baumgarten, Ochsner Health Medical Director of Infection Control and Prevention. Thanks for being here, Dr. Baumgarten. And we have Dr. Aaron Bivens, LSU Civil and Environmental Engineering Assistant Professor and co-founder of the COVID-19 Wastewater-Based Epidemiology Collaborative. Thanks for being here, Dr. Bivens. So first, I would love for you all to just take a few moments to tell everyone what it is that you do, and also how COVID has really impacted your day-to-day lives, as far as your role in this pandemic. So Dr. Hassig, let's start with you.
Thank you, Emily. I'm very happy to be here with you today and with my fellow panelists. I am an infectious disease epidemiologist, which most people didn't realize existed as a career path before this pandemic, and I totally understand that. My whole career has been focused on studying how infectious diseases move in populations, trying to figure out why they occur in some places and in others, in different parts of a population rather than others, how we can prevent them, and ultimately, hopefully, get rid of them. I started with HIV, and this COVID pandemic has been a real challenge. It's kept me up late at night, many nights, and in my teaching, it's provided me to excellent examples to give to my students in terms of the theory that I would otherwise be talking about in coursework.
Yeah, and I know you have been kind of my personal guru throughout all this. I have been lucky to be able to talk to you so often, so I'm happy that you're here with us today.
You've earned a few graduate credits in epidemiology. Yes.
Thank you very much. Dr. Baumgarten, let's go to you.
Hi, I'm Catherine Baumgarten. Thanks so much for inviting me to be a part of this great panel today, Emily. I'm honored to be a part of it with both Dr. Hassig and Dr. Bivens. I am a physician at Auctioner. I started in infectious disease, which means I treat patients that have infectious diseases. All of us have them at some point or another. And then in my mid-career, I began working to prevent infections in people that might come to the hospital or might get infections while they're in the hospital. And part of that now is, and actually was taken over in 2020 when COVID started becoming prominent. Because of course, that's what we do, is try to prevent people from getting COVID and from getting infected from COVID. So the last 2 years have really been dedicated to prevention, treatment, diagnosis, everything having to do with COVID, and really making sure that we do whatever we can to prevent more people from getting sick. I've also seen countless patients with COVID and treated them as well. And so currently, thank goodness, the numbers are better. So getting back to some of the things that we did before in terms of preventing infections in hospitalized patients, taking care of things we see in the community, vaccinating, all of the good things we do to prevent illnesses. But thank you so much for having me today. I'm happy to be here.
Yeah, it's great to see you. You know, I've talked to you a lot during this pandemic as well. You know, put up COVID units at the very beginning, and we've walked those halls together. So thank you for being here. And Dr. Bivens, let's go to you.
Yeah, sure. Thanks so much. Thanks for having me on. My name's Aaron Bivens. I'm an assistant professor in civil and environmental engineering at LSU. I'm an engineer, so I've spent quite a bit of time designing wastewater collection systems and treatment systems. I'm also an environmental microbiologist. So wastewater surveillance for COVID-19 kind of merges those two things together. I got involved with these efforts in March of 2020. I was at Notre Dame at that time, working as a postdoc, and news got out that it seemed like people infected with this virus shed the virus in its materials in various body fluids that end up in sewage. And so we began to have a look, and I launched the wastewater-based epidemiology collaborative as a way to allow people to quickly and easily share information on how to do this, what sort of observations people were making. And it's now over 1,300 members and members in every time zone. So it's a global phenomenon now. And of course, wastewater surveillance is now being widely used to monitor COVID-19 in communities.
Yeah, this is something I've been hearing more and more about, but I know you've been kind of at the forefront of this since, 2020 and probably even before that. So yeah, really excited to have you explain that to everyone today. So I want to start just with a sense of where we are right now. So Dr. Hassan, can you tell us what's going on in Louisiana? What happened after Mardi Gras? There was a lot of talk about this crazy large gathering is going to cause infections. So tell us what's been happening.
It was certainly a concern. The decision to hold Mardi Gras this year, I think, was ultimately proven to be a good choice. We saw relatively little impact in terms of cases or hospitalizations in the New Orleans metropolitan region, and none in any other part of the state where other Mardi Gras activities take place. A very slight blip in reported cases, a very low, brief increase in hospitalizations in the week or 2 weeks after Mardi Gras, and it settled back down immediately. It didn't initiate a new surge. Obviously, the tremendous concern around Mardi Gras is just the volume of individuals that come into the city and surrounding area from all over the state, the country, even the world, to enjoy the festivities that are Mardi Gras. And so that is a real challenge when we're facing a respiratorily transmitted virus like SARS-CoV-2. We benefited, I think, in the case of New Orleans, from having a very high level of vaccination in our residents. We benefited from being on the very downslope of the Omicron surge. So we had some naturally acquired immunity in all of the individuals, whether they were counted and reported or not, that got infected with Omicron. So that protection, whether or not they were vaccinated, was also beneficial to us in the short term. So it was really kind of the Goldilocks zone, I think, in terms of having an event such as Mardi Gras, plus the fact that it was mostly outdoors and the parades and everything else were, outdoor events, albeit crowded. And so I think we were fortunate that the circumstances and conditions timed with our Mardi Gras calendar this year.
I've not heard Goldilocks zone used before to describe it, but I think that's really a perfect way to just describe the timing of it all and kind of where we are as a community with the number of infections and vaccinations. So that is the very positive news. Maybe you can kind of look ahead and tell us, like, what does this mean? There's a very different vibe right now as far as where we are with COVID. I go to the grocery store, I don't see very many masks. So looking ahead, what do you foresee?
Well, I can totally understand the different vibe. I still wear a mask when I go to the grocery store, but I'm an infectious disease epidemiologist. So, but I do think that, this is a period of time with the levels of infection that we are able to track in the population, the low level of hospitalizations that we are experiencing, and the vaccination coverage isn't going to go away. So it's still very beneficial to us as a community. But I think that we cannot assume that the conditions that we're experiencing right now are necessarily going to be what we will experience in 3 or 4 months. I think that we have to recognize that Louisiana and the New Orleans metro area have experienced a surge of some variant or another of this virus about every 6 months. And so we have had 2 summer surges in the past. Delta was the most recent one, and that was a brutal surge. We had vaccination in place to a substantial extent, but we wound up with very, very high numbers of hospitalizations and deaths from that surge. And we are now concerned about the new variant that's causing problems in Europe. The UK, which has been a good indicator for the United States in past surges, is seeing a rise in cases and a rise in hospitalizations, and that's very concerning. New York is starting to see a little bit of a rise in cases, and they are often a month or so ahead of New Orleans and Louisiana. So there's something out there, but we don't know yet how substantial or what kind of impact it will necessarily have on us. I think we just need to be ready to respond. We prepare for hurricane season. We need to prepare for the next surge of SARS-CoV-2 virus.
Yeah, and when you say the new variant, you mean BA2, which is sort of, I guess, a different version of Omicron. Maybe Dr. Baumgarten, you can tell us a little bit about BA2 and people hear Omicron, they think we've already done that. Why is BA2 a concern?
Right. So people do hear Omicron and they, as you said, think, been there, done that. Why do I need to worry? What do I have to be concerned about? And like Dr. Hassan mentioned, we saw a large number of hospitalizations with the Delta variant. And in midsummer, she mentioned, we saw a surge in midsummer, and we saw the most number of hospitalizations with Delta, over 1,000 at Ochsner Health Systems. And then again in mid-January, she talked about, kind of that every 6 months surge that we've seen. And again in January, over 700 hospitalizations here at Ochsner. So we saw that with Omicron as well. And so when we talk about variants, we talk about different types of COVID. So Delta was one variant, and then Delta and mutations emerge. So what happens is a virus, as it circulates in a community, will mutate. And when it mutates, it can develop ways to avoid our immunity that we have. It can avoid the immunity that we have from either having COVID or perhaps from vaccination. And of course, people that are more vulnerable may not have as good of an immune response, so they are also going to be more vulnerable to new variants. And so with Omicron, the BA.1 variant is the one that we started out with. And remember, when we talked about that in the past, there were over 30 mutations in that variant on the spike protein alone, over 50 mutations on the virus itself. And then BA.2 is just a subvariant of that. So it's almost like a child of Omicron, is how you can think of it. And it has developed further mutations that make it a little bit different from BA.1. And so what that means is that, as Dr. Hassan said, even though the UK has had vaccinations, has had Omicron BA.1, it is a barometer for what we see in the United States. And it does look like they had increased rates of this stealth variant, or BA.2, that caused increased numbers of cases and hospitalizations in Europe and in the UK. And so it does sound concerning that that might happen here or could happen here. Now, currently, fortunately, we are not seeing a lot of cases of Omicron in general, but we are starting to see increases in the amount of BA.2 in the United States. So for instance, we were seeing primarily BA.1 for a long period of time with Omicron. And then now in the United States, we're seeing about a third overall of BA.2 and 2/3 of BA.1. In the Northeast, in some areas, like Dr. Hassan mentioned, New York, that sort of thing, we're seeing more than 50%, and those cases are increasing. And then in Louisiana, we're seeing about 16% so far in the last data that was released from our Office of Public Health of BA.2. So we are starting to see rises in the number of that particular subvariant. And the WHO and CDC have named that subvariant a variant of concern, which means we have to keep an eye on it. We have to keep track of our positivity rate, hospitalizations, that sort of thing. Fortunately, though, currently we are at the lowest point since COVID began of our hospitalizations, at least at Ochsner, and we only have 16 patients in the hospital across our system currently. So that's good news, and that does give us a breather, but it means we still have time and we need to prepare. That's the message here. We need to be ready because, again, we just don't know. What we know about COVID is we don't know. It's very unpredictable. Variants, mutations develop. The one thing I've learned is not to try to predict what will happen with COVID, because anything can happen.
And so as far as how people are thinking about BA.2, do we have good evidence yet that infection with BA.1, you may not be a good host for BA.2? Like, does that at least provide us some protection, especially here in Louisiana where we had such high levels of infection?
We hope so, but again, it depends on timing, right? So the issue with immunity due to any virus, but also what we've seen over and over again with COVID, is that immunity wanes, right? And so in order to have that protection, you probably needed to have recent infection, right? As you go further and further in time from the infection that you had or the vaccine that you had, your immunity wanes over time. Or if your immune system is compromised, you may not have mounted as good of a response to either the initial infection with COVID that you had or a vaccine or booster. So in those circumstances, that's when this virus can then take advantage of our immune systems waning and then set up shop, can develop mutations like we talked about, different variants, that sort of thing, whether it be BA.2 or some other new strain or variant. When your immune system wanes, that's when these surges could then occur. And we do know from data from Israel that immunity wanes over time, and boosters can help return that immunity. And we've seen that effectiveness, especially in elderly patients over the age of 60 from Israeli data. So that's a discussion about vaccinations still being key, and then boosters and timing also still being key in preventing serious hospitalizations and death from COVID.
Okay. Yeah, I know overall in Louisiana, our vaccination numbers are still pretty low. I think it's about 53%,
Right.
Which leaves a lot of people who, maybe a portion of them have been infected. But as you said, that kind of buffer that provides starts to fade. So we could get into that situation where.
Right. And then it's been a while since we've had boosters. So for those of us that went out and got our boosters when they first became available, that fades over time too. And so the FDA is talking about approving boosters. We're hearing perhaps in those over the age of 50. Pfizer has asked the FDA to approve vaccination boosters for 4th dose for those that are over the age of 65, Moderna for everybody. So we'll have to see what the FDA says and how they decide to take that information and that data and then what recommendation they'll make.
Okay. And I can remember, over last surges, hospitals telling employees, go ahead and take some time off. There's probably something coming. Is that kind of the situation you all are in right now? Like, how are hospitals preparing?
Well, whether it's good or bad news, we kind of know what to do now in terms of the protocols and the measures we put into place. Those are already established. Remember when we first started, you were with us, Emily, and all of this, doing a great job reporting. I mean, we didn't know as much as we do now in general. And so the good news is we have established protocols. We have so many more medications, vaccinations, all of those things available to us. So we feel prepared, but you're right. We have staff that are tired. They've been working nonstop for over 2 years, taking care of patients with COVID, plus patients without COVID, because of course, those other illnesses and diseases don't stop either. So we are taking a little bit of a breather now, but we're not letting our foot off the gas pedal. We're making sure that we're prepared and ready to go. And we still have new treatments coming out. We're still, I was even on a call this morning when we're talking about how we're positioning treatments, how we're positioning our antibodies. For those that are immunocompromised, we still have antibody treatments to prevent COVID that we are trying to make sure that those that are eligible or need those treatments are available. So we're still doing a lot, getting vaccines out to try to prevent these surges from happening in the future. But yes, I am doing things that I've ignored for probably 2 years now and getting back to some of those things that, was my job before COVID started.
Gotcha. And as far as, understanding where we are, I think Dr. Bivens, this is kind of where your work is starting to become more prominent just on a nationwide level. We've heard a lot about wastewater surveillance as we get into a place as a country where we're kind of, as people say, like living with COVID a little bit more. So tell us, for people who have never heard of wastewater surveillance, tell us what it is and how it works.
Yeah, so the idea behind wastewater surveillance is actually quite simple. When humans are infected with these viruses, they replicate inside of our bodies. And so oftentimes the virus and its genetic material, its genome, as it's called, we shed that material in various body fluids. So with SARS-CoV-2, we've been observed to shed it in our sputum, in our saliva, in our stool. Some people even shed in their urine. And so a lot of this material is collected in our wastewater system. So, right, if you brush your teeth, obviously using the restroom, things like that, all of that is collected and concentrated to a wastewater treatment facility. And so what's unique about this signal compared to clinical surveillance is that most of the literature indicates that this shedding is happening whether you show symptoms or not. And so asymptomatic folks that don't even know they're infected will also be shedding this material. And so what that means is when we measure in wastewater, we can measure this material in wastewater and kind of gauge its rise and fall as a way of gauging the rise and fall of COVID-19 in our communities. COVID COVID-19 is getting a lot of the news right now, but really the first time wastewater was used to do something like this was around 1928, 1929, when scientists used wastewater to study typhoid fever. So this is not a new approach. It is new to use it for a respiratory illness. So I think one of the things that we've learned is even an infection that is respiratory, there still might be signal in wastewater that we can use. And so that's what's happening now all over the globe, all over the world, is research teams are looking in wastewater, basically making measurements either a few times a week or even daily, and looking at how these levels of SARS-CoV-2 genetic material in the wastewater are changing, and using that to kind of keep a gauge on what we might expect in terms of COVID-19 cases and hospitalizations. The global experience, what we've observed all over the world is that, as your clinical surveillance becomes weaker, then the lead time wastewater provides becomes longer. So, as less people are going to be getting tested via PCR and lateral flow test, or maybe they test themselves at home and they're not officially reported as a case, wastewater becomes even more useful in these cases because it provides a less biased source of information about what's happening in the community. So, that's it in a nutshell, more or less.
Yeah, I know after Mardi Gras, I did, know some people who tested positive. And I think most of these people are just using the at-home tests, which are great, but also leave us sort of in the dark. So, I think, wastewater is where that comes in. And you had mentioned to me there was I think it was a school in San Diego that was providing this. You can do it on a very small scale. And the parents at this school would get their kids tested more often when they knew that it was in the wastewater sample, right? Versus, they've been exposed somehow, or get your kid tested every now and then. So it does seem to impact human behavior as well, right?
Yeah. One of the great things about wastewater surveillance is you can do it across a lot of different spatial scales. So we can do it, here in East Baton Rouge, we can do it at the wastewater treatment plant, measure material and get a sense for all of Baton Rouge. Or we can, as we're doing here at LSU, we can measure at individual dorms, and we can basically provide information on that specific population. And so what this team observed in San Diego is, I'm sure we can all relate to this, right? We're tired, getting tested. When I was at Notre Dame, I was tested once a week. Everyone's tired, everyone's fatigued. And so you kind of get this kind of like, whatever. But wastewater data, what we've observed in San Diego is that when we informed parents that the wastewater had tested positive from the school, we saw a huge increase in how many parents actually had their children tested in response to that data. So it jumped from something like 35% to 85%. So 50 percentage point increase because we gave them something that's actually, gives an indication of risk level. And so they're more likely to respond to that with an action. Whereas if you're continually pelted with all this messaging, you eventually just get tired and you stop responding. And so what's nice about wastewater is we can kind of feed specific information to populations and allow them to decide if they want to be tested in response. And that's what happens here at LSU. We test the wastewater from the dorms. We notify the students if the signal exceeds a certain level, and then we don't force them to go be tested, but they can if they so desire. So that's been our approach. The approach, varies by community and by public health officials in different regions use the information to make different decisions. So across all these different contexts, wastewater is providing information that I think is going to become even more useful moving forward as people are less and less likely to get tested and less likely to report that information into official records.
Yeah, I checked the CDC website this morning, and it did look like from that there's only one site in New Orleans, in Louisiana, which is in New Orleans, and it seems we're still doing okay there. But it did look like things were rising in the Northeast. So, Dr. Hassan, can you tell us a little bit about how we should think about these little signals from other places in the country?
I think the unbiased nature of the data that we can get from wastewater is incredibly valuable to have more lead time in terms of recognizing when this particular virus is in a community on a small scale or a large scale. Because one of the challenges we have faced throughout the pandemic is the fact that we don't have a systematic way to test people. It's always been on the basis of decisions being made by individuals themselves in terms of their perception of the threat of the coronavirus or their symptomatic state or being able to even find a test to undergo it. And so the beauty of wastewater is that, it's a system that captures information from everyone, whether we want to contribute or not. It's just there. And so it provides us with the lack of bias in it is one of the most powerful things that I think it brings. And the fact that it will allow us to provide a semi-quantitative understanding in terms of ebbing and flowing of the virus within a community is also incredibly valuable, because as we've seen, we can have a great deal of fluctuation with this virus in communities over any period of time.
Well, yeah, I think from a healthcare standpoint, I think it also weighs in because, I know, we've talked about this before, usually we'll start to see illness in the community, and then we'll see our surveillance go up of our outpatients, our testing positivity rate go up, and then our hospitalizations typically lag behind 2 to 4 weeks. So anything that gives us more time to prepare and get staffing in place, prepare for having that flux of patients helps. So this is something that I think is very good for our community to be able to have access to and to give us an idea of what we need to do, because the other piece of it is taking prevention measures. Because, I think with Omicron, it unfortunately started over our Christmas holiday season, and it was very difficult to convince people to wear those masks and to, get vaccinated. So much was going on over the holidays, and it affected so many of our community throughout the holiday season. So anything we can do to ask people to, get that booster, put that mask on, especially if you're immunocompromised or vulnerable, you should be doing these things preventively all the time. But at least to give our communities a chance to, be prepared and do the things we need to do to mitigate what's coming.
Yeah, and I know a lot of institutions, as you said, Dr. Vivens, LSU is doing it, Tulane is doing it. You can do it sort of at the institution level, but right now the only places reporting to the CDC are 2 sites in New Orleans, right? How much would we need to be doing to really get a good picture to provide enough information that could influence our reaction?
Yeah, the CDC has started the National Wastewater Surveillance System. And as part of that system, New Orleans is recorded. Data from East Baton Rouge is recorded as part of, I believe, BioBot. BioBot is a large startup company out of Boston, Massachusetts that's doing this. And I believe East Baton Rouge is participating in their network. And then we also test some samples for East Baton Rouge here at LSU. So there are other, realistically right now it's New Orleans and Baton Rouge that are covered. My understanding is the Louisiana Department of Health is looking into this and is looking to scale this across the state. It's a system with trade-offs. It's important to recognize that, for us to get a signal from a lot of people, we need a lot of people connected to the wastewater system. And so where you typically see that are large cities and municipalities. So you can imagine that in rural places, it's where people have their own individual septic systems or aerated treatment systems. This is maybe a bit more difficult to scale. It might be more efficient to just test individuals than to test the sewage from 4 people. But nonetheless, in our major metros, and we can also be strategic about monitoring maybe schools in certain communities, places where people aggregate. And so we can be smart about how we deploy it. And we can gain a lot of information about a large percentage of the population with, maybe a few hundred sites. And as far as the frequency, as I mentioned, some places they're taking samples daily. Most of the information that I've seen, it seems like maybe 3 times a week is sufficient to keep a good feel for how COVID-19 is maybe either increasing or decreasing. So there are lots of decisions you have to make when implementing a system like this. For instance, what are you going to do in response to the data? And where you decide to monitor is directly affected by what you hope to do in response. So all that's going to have to be rolled out as the system moves forward in Louisiana.
Yeah. And it just kind of reminds me that, the phrases we've been using this whole time, it's like another tool in our arsenal or, what have you against COVID-19. It just makes me think of the other things that have been developing. Dr. Baumgarten, you mentioned, new therapies. Are we confident that those would work against any kind of BA2 surge or, a new variant? How are we thinking about those tools?
So we were just talking about this morning as we prepare and try to make sure we prevent illness. And so, as we found out with Omicron, some of our other antibody treatments were not as effective. And the FDA actually asked us to stop using Regencov because it did not seem to be as effective for Omicron. And so with the BA2 variant, we're keeping an eye on this. It looks like there is a monoclonal available that treats it, which we have. It's still allocated by the state and is under emergency use authorization, and that's bebtelovimab. So, that's an injection when somebody gets COVID, and if they have risk factors for serious disease, that's when we consider that treatment. Still, the best way to prevent and is to not get COVID. And so, we talked about vaccinations and boosters, and certainly, companies are trying to develop booster vaccines that may cover additional variants that we may not have even seen yet. And so that's something that companies are looking to and that are in development. So we'll see how that goes. The other piece I'd like to let this audience know about is the Evusheld, which I mentioned earlier, which is another passive treatment or antibody. Instead of somebody who can't develop a response to the vaccine, we give them immunity like a vaccine would, but since they can't develop that immunity from a vaccine, we still try to vaccinate them first. But there is a medication that we give through an injection called Evusheld that prevents COVID for about 6 months. And that's been shown in trials. Again, it's emergency use authorization, and we've given that to patients and are available to give it to those that are at risk. We only give it to high-risk patients that have medicines that compromise their immune systems, transplant patients, those that are undergoing chemotherapy, those sorts of patients that might have increased risk and do not mount a good response to the vaccine. So we're continuing to see these treatments out there and develop. We're also seeing treatments that are orally available for COVID, and they also appear to be effective for BA2. So things like Paxlovid and molnupiravir that are still on allocation, but are available in pharmacies. So those sorts of medications are also out there. Again, the supply is on allocation, so we don't have an unlimited supply, and we try to make sure that we use these judiciously in the right setting. And they also have side effects. Of course, with any medication, you have risk for side effects, so we have to make sure we use it in the correct patient population. But again, therapies are still evolving, coming out, and we are evaluating each of them for what they're effective against. We don't know yet, though, what future variant may develop. And so, again, it takes a little while once that variant can happen or mutations can happen for us to be able to test that and see what works best with it. So those treatments are subject to change depending on what becomes the predominant variant. But for BA2, we do have good treatments available. We do have good options. But again, I always have to emphasize that vaccination is really the best way to prevent getting Omicron, BA2, BA1, whatever strain at this point in time.
Yeah.
I would just add that masking is also a really valuable protective and preventative strategy that protects against any variant. And so that we also need to remember that we have multiple possibilities to layer. And we have seen throughout the course of the pandemic that reliance on just one thing is probably not a wise choice. And so looking at incorporation of multiple strategies is very valuable. Even in a setting of an indoor space with multiple people present, an individual wearing a high quality mask, a KN95 or N95 mask is really providing themselves a very, very strong level of protection, even if other people in that space aren't wearing a mask. So it's important to consider that as well.
Yeah, and just, thinking about that point and what Dr. Baumgarten brought up about Evusheld, we did get a question about immunocompromised people and what they should do as they see fewer and fewer masks around them. And, things are just really starting, I think, to open up in ways that we haven't really seen before. What would you say to those people? Like, what should they do?
I definitely think that anybody that is in an immunocompromised state should most definitely continue to wear a mask. The CDC has made in their statements about community level, which has included as part of that any individual that feels that it's important for them to wear a mask should be encouraged, allowed, not in any way dissuaded from doing so. And I think that's a really important component that we all need to remember, is that each of us has a different tolerance and a different set of circumstances that we're going to shape how they make decisions about protection and avoidance of infection. And we need to allow people the choice to wear something, even if it's not mandated, not to hassle them or tell them they can't come into a place of business if they're wearing a mask. It's I think really important, but I do think immunocompromised individuals are in a challenging position because the options, while we do have the pre-exposure monoclonal antibody, it's in limited quantities. It's not enough for everyone that might have need of it. And so I think it's a really challenging time right now for individuals that are immunocompromised. And I think the people around that person, their family, their friends, and their more broadly, their community really need to think about the fact that individuals that are particularly vulnerable are present, and we all need to try and keep some consideration in our actions and our thoughts for how we can help them.
Yeah. Okay. And just as I'm thinking about what I'm taking away from this conversation, it seems like there are still a lot of unknowns right now, right? Like we're still, like maybe even in a bigger way than I've really thought of other lulls. But I wonder if you have any kind of final thoughts on how people should think about this time period and what we can really expect. Like, do we have several months ahead of us where it will feel like it does right now? And how should we be gauging our own personal risk?
Do you want me to start?
Yes.
Okay, sure. Well, I think throughout this pandemic, each of us has probably made decisions and calculations on the basis of our own individual health status, the health status of our families, and what we can tolerate in terms of the risk that we might take in participating in activities relative to SARS-CoV-2. I don't think we should stop doing that, frankly. The gradation or the decisions may be different given the, as far as we know, low level of infection circulating in our community right now. But I think we have to be psychologically as well as physically prepared for possibly needing to take some more substantial action, or reallocating or recalibrating, I guess is the right word, that particular process of decision making, depending on what happens over the next few months. I do think we have some time here in the New Orleans metro area and in Louisiana, perhaps generally, before BA2 may rear its ugly head in substantive ways here. What we have seen in other parts of the world is that it takes BA2 reaching 50% or higher in terms of the proportion of infections in an area before we start seeing the rise in cases and the subsequent rises in hospitalization. So we've got a little bit of breathing time, but I think we need to recognize it's here. Just as, SARS, Omicron, when it first emerged after Thanksgiving, was here. And so the actions we take now can influence what happens in a month or two. So I guess I would say, enjoy the nice weather, enjoy outdoor activities, but, even in a crowded outdoor space, I would suggest that people carry a mask and consider putting one on if they feel too crowded.
Okay, so it sounds like Jazz Fest is probably definitely going to happen, but that everyone should keep in mind, if we want those things to continue to happen, that COVID has not just disappeared. It's, waiting all the time.
It's unfortunately not gone, and we do not have good tools right now because of the lowering in testing behavior to really have I think a good picture of what's happening.
Okay. And Dr.
Which is why wastewater is so important.
Yes, yeah, we keep coming back to that. Dr. Baumgarten, what are your predictions for the future and your advice for people who are really trying to understand how they are fitting into this, somewhat new feeling COVID landscape that we're in?
Well, I would echo Dr. Hassig's sentiments and also add, this is a great time for festivals. It's a great time to be outdoors. It's the best weather that we look forward to, and it's gone in a second. So we all want to be outdoors and enjoying it. But I would also echo that, I had one of our physicians call me about his sister just this past weekend, terribly worried because she got COVID and she was immunocompromised and on medications to suppress her immune system. And so the person next to you could be immunocompromised, and you may not know that. They don't wear a sign that they're immunocompromised or that they're fearful, and they want to enjoy this sort of weather and everything we're doing as well. So I do think it's vitally important to allow others to wear that N95 or KN95, encourage it, not discourage it. And I think that a lot of immunocompromised people are still scared and worried about, what's next, as are we, because it does stress our healthcare system when we have these surges. And so we can hope for the best, but we have to prepare for the worst. And with this upcoming season, we want to enjoy it. We're all, enjoying the beautiful weather, even this past weekend, and want to be outside with Jazz Fest, with French Quarter Fest, with the bounty of Louisiana being celebrated, with all those things we love. But to celebrate, you should vaccinate too. We need to vaccinate to be able to celebrate and do that safely, both for ourselves and for those around us. And then the other thing that's a little more sad that we've had happen has been natural disasters in our areas, which bring us together in ways that maybe we don't anticipate or love. But my heart goes out to those with Ida, for those who just had last week, the tornado ripped through their neighborhood, and then they're thrown into a situation, perhaps in a shelter or living with family members. And in those situations too, we need to be prepared, not just by getting water, not just by getting food ready, not just by battening down the hatches. We really need to be vaccinated and prepared for our health as well. So I would encourage everybody to continue to get their vaccines. We'll stay tuned to see what the FDA says about boosters. If you are immunocompromised, please contact your physician or healthcare provider or clinician about consideration for monoclonal preventative treatment. Wear your mask. Don't rely on these treatments, but wear your mask when necessary and when you're especially in those indoor spaces. But it's time to celebrate. So, make sure you do it as safely as possible, but get out there and enjoy Louisiana and our culture and our region. It's what we love. It's why we're here.
Yeah, I think it was Dr. Hassig, I think you said to me that everyone should have a COVID prep kit as well as a hurricane prep kit, which I think is good advice.
Mm-hmm.
Dr. Bivens, you also told me, that the wastewater surveillance is sort of like a weather report, using these weather metaphors. So tell us, as we get into a really unknown period, like how you think that we can best think about wastewater surveillance just on a, an everyday person level. Like, should they be checking the CDC website and what is really, going to happen next?
Yeah, I think of, I've heard others describe the wastewater surveillance data as a weather report, right? And if the weather looks like it's going to be rain and storms, then maybe you should leave home with an umbrella. And so I think in that way, paying attention to the wastewater data can be useful in terms of masking. I know, for me, I tend to think of this as a deck of cards. And, the more people in your community that are infected, the more jokers are in the deck. And every time you go out and interact with someone, you could be drawing a joker out of that deck. The wastewater data can give you an indication for how many jokers might be in the deck. So I think it's useful as a way of monitoring the situation in your community, and then you can modulate how you make decisions based on that information. And so, I'm hopeful that LDH will be bringing something online soon, and it'll be useful for all Louisianans to make good decisions heading into the summer.
Great. Well, thank you all so much. I really appreciate you all being here. Like I said, I get to talk to you all the time, and experts like yourself all the time. And it does help me make my own decisions. And so I hope that's what we brought to people today. So I really appreciate you all. And I hope you enjoy this weather right now as we are in this great season.
Thank you for having us.
Happy to participate.
Thank you.
Great.
Thanks for all you're doing.